My name is Jimmy Hamill. I'm a retired management accountant, but very active at the moment on the SOAS committee. I'm going to run through a reasonably quick data presentation that focuses on regional and local data, specifically mainly around travel time and then the other impacts. It will be heavily reliant on the slides, so if you can keep an eye on the slides as we're going up through it. We're going to go through two reports quickly. We'll just obviously do a summary of them. The first report is a report that we commissioned specifically from Ulster University in October that we got in November. And the second report builds on the information that was received from the Ulster University report. We've then done our own detailed deep dive on information based around Fermanagh and Tyrone. The first report, called Accessibility to Type 1 EDs Across Northern Ireland, a GIS Analysis. It's a bit wordy. It was completed by Dr. Paul Mackenzie from the School of Geography and Environmental Sciences at Ulster University. It's a formal Ulster University report that has been fully and properly commissioned. He used geographic information systems to analyze hospital locations and road networks. He can then build that into a comprehensive travel analysis. We asked him to look at a scenario where SOA is no longer a Type 1 emergency department. His main overall summary was that most Fermanagh patients will no longer be within 60 minutes of their nearest Type 1 ED as a result of SOA being downgraded. We need to just refer briefly to an important review that was done by the Department of Health in March 2022. It was published. This is the review of urgent and emergency care in Northern Ireland. This is not the review of general surgery that the Western Trust referred to extensively in their consultation. There was a second review done as well 3 months before that, which was the review of urgent and emergency care. Our strongest concerns are around emergency care for the Fermanagh-Tyrone area. Robin Swan at the time, the main foreword, my vision for the future is to ensure that all citizens in Northern Ireland have equal access to safe, urgent and emergency care services tailored to their specific needs at the right time and in the right place. Key phrase, equal access. In the document itself, it defines the 3 types of emergency department. We're not going to go through this in detail. We're going to focus just on the Type 1 emergency department definition, which is what SOA was before the 5th of December. And that's a consultant-led service with designated accommodation for the reception of emergency care patients, that's us, providing both emergency medicine and emergency surgical services 24 hours a day. Now, we are not providing emergency surgical services at this stage in SOA. We are stating quite categorically, SOA is no longer a Type 1 emergency department. We do not provide emergency general surgery anymore. We asked Ulster University to look at the situation as it was with the 10 Type 1 EDs, including SOA. And it's very simple, and it's very simple to state. There is nowhere in Northern Ireland at present, when SOA was still providing it, with more than 60 minutes travel time to the nearest Type 1 emergency department. Nowhere in Northern Ireland. Ulster University looked at the scenario where SOA is not a Type 1 ED. We can now state that a section of Northern Ireland is now not within 60 minutes travel time to the nearest Type 1 ED. That's that corner in the bottom left there, covering Fermanagh and a section of Tyrone. Travel time now for this area is more than an hour. Now, this was the basis on which Ulster University finished their report. They were able to give us all of the small areas, they're called as part of your ward and super rapid area structure, that are outside the 60-minute travel band. We then did our own report where we analysed this information further to get more local information. We asked 3 questions. how many people are outside this 60-minute travel time? How much longer then is the travel time to Altnagalvin? And what's the potential impact on medical outcomes because of the extra distance? So the first question, how many people are outside the 60-minute travel band? 83,343 people. Our first series of presentations focused on when people were traveling to the nearer of Altnagalvin or Craigavon. It's quite clear now that for the vast majority of cases that any redirection that's happening is to Altnagalvin. It isn't to Craigavon. So it's 83,343 people. They're all from Fermanagh and Tyrone. When we analyse those figures, that's 4.4% of the population of Northern Ireland, which makes it difficult for us to have our voice heard. That's a very small percentage. It's 100% of the population of Fermanagh. Every single person that lives in Fermanagh is now outside the 60-minute travel time to their nearest Type 1 emergency department. That's 64,278 people. That's a lot of people. That's absolutely everybody in Fermanagh. In Tyrone, it's 9.7% of the Tyrone population are outside the 60-minute travel band. It's 71% of your council area. 71% of the population of Fermanagh and Omagh District Council are now outside the 60-minute travel time band to the nearest Type 1 ED. You have to remember, nowhere else in Northern Ireland is asked or told to travel anything over 60 minutes. Our analysis from Ulster University shows that even if Causeway or Daisy Hill lost their Type 1 ED status, they would still be within 60 minutes of either Craigavon or Antrim for Daisy Hill, or Craigavon or Ulster, or Antrim or Altnagalvin. The next question we asked was, how much longer is the travel time? Okay, for the 83,343 people. At the moment, to travel to SOA, the average travel time is 26 minutes. Travel time goes as high as 46 minutes for the Fermanagh area in Newtown Butler, or 51 minutes for the Tyrone area from 6 Mile Cross. Travelling past SOA to Altnagalvin, average travel time increases to 107 minutes. 107 minutes, that's almost 2 hours. On average, that's an extra 81 minutes to get to Altnagalvin over the time it takes to get to SOA. That's an extra 81 minutes. The travel time from the Newtown Butler area is 2.5 hours. And I think it's one of the most telling stats that we have is that almost 20,000 people, 19,138, are over 2 hours away from Altnagalvin. We did a breakdown, which is quite difficult to see on the slide, but we will make the presentation available to you afterwards, both by Fermanagh and by Tyrone. We can see from the figures there, the average at the bottom, the average travel time to SOA, 23 minutes for the Fermanagh cohort. The average travel time then to Altnagalvin for those 64,000 people is 130 minutes. That's an extra 90 minutes. When you just take the Fermanagh section out, it's an extra 90 minutes on average. Okay, that goes up to as high as, you can see there, it's 105 minutes for the people from Bow, Cleenish and Letterbreen. They're very significant travel times that are not asked of anyone else at all. Okay, the question two, how much longer is Fermanagh travel time? So very significant. How much longer is Tyrone travel time? The Tyrone factor, again, we were focused on Altnagalvin. We do accept that people from these areas may well travel to Craigavon instead, but we're working on the basis that they're part of the Western Trust demographic. This was looking at all the people in the Western Trust, okay? And so you can see there the overall figures for Tyrone, 19,000 people outside 60 minutes. The average extra travel time is 51 minutes. Okay, average travel time to Altnagalvin is 87 minutes. Still very significant. Okay. Our third question, I know there's quite a lot of information here very quickly. Are medical outcomes affected because of the extra distance traveled? We can say extra distances traveled in life-threatening emergencies leads to poorer outcomes with increased mortality and morbidity. The key here, we're talking about life-threatening emergencies. Our main concerns are around emergency cases. This is supported by a significant body of peer-reviewed medical articles and research, very significant. Average distance traveled for these people is now 55 miles is the distance they actually travel. Fermanagh people will need to travel an extra 47 miles on average. We haven't even factored in properly the roads infrastructure and the deprivation identified with this area. We look at one article when we try to assess the actual impact. The article is called "The Relationship Between Distance to Hospital and Patient Mortality in Emergencies," okay, an observational study. 2 lines from the study: an approximate 1% absolute increase in mortality associated with each 10-kilometre increase in straight line distance. What that's saying is that for each extra 10 kilometres you travel, there's a 1% increase in the chance that you might die on the journey. The second sentence we've taken from it: this means that, other things being equal, closing local EDs could result in an increase in mortality for a small number of patients with life-threatening emergencies who have to travel further as a result. The last of my slides then are taken into consideration that factor about the 1% increase in mortality for each 10 kilometres in straight line. We can then assign that to the average distances. Okay, so we can say that for all the 64,000 Fermanagh people, okay, they travel on average an extra 65 kilometres in straight line. And that means, in effect, okay, and this statement, not intending or trying to shock anybody, but this is what the facts say: 1 out of every 15 Fermanagh blue light emergencies will result in an unnecessary death due to the extra distance travelled. We're talking about the extra distance here only. That's what we're talking about, the extra distance over travelling to Altnagelvin rather than to SOA. This goes as high as 1 in 13 for the Enniskillen area.